Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Aim, triple board certified cosmetic surgeon and OBGYN. Let's get polished.
Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome to another Polished Beauty segment in the Expert on the Microphone series. Joining me today is my brilliant segment host, Dr. Daisy Aim. She's a triple board certified cosmetic surgeon and highly respected obstetrician and gynecologist. She's also the host and creator of the Polished Beauty podcast. Today, we're diving deep into the world of beauty, confidence, and the fine line between enhancement and obsession. Joining us, we have a special guest who is no stranger to the world of beauty and transformation, Dr. Carl Truesdale. He's a double board certified facial plastic surgeon based in Beverly Hills. And since opening his practice back in 2021, Dr. Truesdale has made waves in the cosmetic world with his expertise ranging from facial rejuvenation to corrective surgeries. He's helped countless people recover not just their looks, but their confidence after botched procedures. And he's even opened his own hair restoration clinic, Crown Hair Institute. He's a true visionary, running his own production company and reality YouTube series on top of all else, Beyond the Surface, Beverly Hills.
Dr. Truesdale is also the founder of Truesdale Foundation, which provides life-changing corrective surgeries for those who may not be able to afford them, including military veterans, domestic abuse survivors, and victims of bullying. So much to unpack today. Let's dive in.
Welcoming now to the show is the amazing Dr. Carl Truesdale. Welcome, superstar.
Thank you for that kind introduction.
You deserve it.
All right, let's kick off with a topic that's on everyone's mind, botched cosmetic surgeries. It's something that can truly devastate both mentally and physically. In 2022 alone, corrective procedures skyrocketed with an estimated 30% of patients seeking revision surgeries. And we know that this can lead to a loss of confidence and a lot of trauma. So Dr. Truesdale, can you walk us through the process of how you approach facial reconstruction after a botched procedure? And what does it take to rebuild not just someone's face, but their confidence?
Whenever we do anything with the face or cosmetic or plastic surgery, there's never a guarantee of a result. But sometimes the result can be actually a bad one, so unacceptable. And that's what we mean by botched. So whether that's a facelift that's pulled a little too tight, or maybe it looks irregular, or the ear is pulling, or the eyelid can't close anymore, or the scar is unsightly, or maybe the hairline is too low, or maybe someone lost hair, a facial nerve injury. I've seen all of these things. And so the way I approach it is the first thing I ask the patient, what's going on, how they got there, and really just try to get to the emotional part of, what they're going through, because it's usually both emotional, taxing, as well as the physical. Then I look at the problem, the form, and all the techniques available to me to try to give them back their form and their function.
Yeah, that's really good. I mean, if you can give us an in-depth insight into the technical challenges of reconstructing a face that has already gone multiple surgeries, because I think a lot of patients don't understand that, the technical difficulty of this. So if you can just elaborate on it for us.
The face, there's no mask, there's no bra, there's no shirt if you don't like it. So one, the attention is higher, the stakes are higher. But two, there's scar tissue. So the anatomy has already been altered. The things where you were born, where we might find that nerve or that muscle or that, that fascia is now different. On top of that, a lot of times when I'm doing revision surgery, they've taken things out, maybe they've put things in that shouldn't be there. And I have to work delicately around those structures while preserving the arteries, the nerves, and not maim someone. So it can be very, very challenging. You're also dealing with a patient who's been through an unfavorable outcome. And so you have to treat them with a little bit more, delicate nature and, a little bit more of a gloved hand approach.
There's no denying that when you look at the overview, Hollywood has a massive influence on global beauty. And I think it all starts there. When you look at these recent surveys, they show that over 60% of millennials consider a cosmetic tweak based on celebrity trends. What are some of the trending facial procedures that patients are requesting based on what celebrities are having done? And do you think these trends are setting healthy beauty standards, or are they pushing an unattainable ideal?
I think some are good and some are bad. And, my approach to plastic surgery is one that's natural. So if you look at my work on Instagram or even my YouTube show, you'll see that I'm trying to enhance their natural beauty, their natural features, while keeping them looking like themselves, just better versions. But a lot of times we're seeing examples where that is not the case. I don't think that those examples are good. I think overall, though, the society is kind of moving towards that more natural, nuanced approach. So we're seeing less of the big overfilled lips. We're seeing less of the unnatural looking plastic surgery where we're looking at people who are enhancing their form. So we're turning away from a little bit, over excess of the fillers, more towards the fat transfer, which can have a little bit more of a natural appearance, a little bit more away from kind of the more like the threads and more towards the biostimulatory injections or exosomes, which are nanovesicles, which stimulate collagen growth and improvement in skin quality. So we're trying to get the most out of what the patient is bringing in before we start jumping into things that can radically change the way that they look.
And you mentioned threads. Do threads influence the outcome of a facelift, and do they complicate the outcome?
Do they influence? Yes, they influence it because they're leaving. So threads leave behind like a scar underneath the skin. And I'm very commonly seeing this and have to navigate around that. If you don't have an expert surgeon doing your surgery, you, in my opinion, are more likely to get lost or even injure something. Because when the thread is kind of, goes away or kind of leaves behind this thread of scar, when you're navigating it, the tissue planes become a little bit more fused. And when I'm operating in the face, there are little nerves that control the muscle. If those nerves are cut, the face is paralyzed. So it's high stakes here, right? And so you don't want anything else in there that makes it harder to do the surgery. Why I tell my patients before surgery, dissolve your filler, let's get a blank canvas so that I can do my magic.
So, what's your take on the trend of younger patients seeking minimally invasive cosmetic procedures? And do you think it's creating unrealistic expectations for natural aging?
We've never wanted to look old. And so some of the techniques, both surgical and minimally invasive today, can make people who otherwise would look much older look younger. And that has an effect on their confidence, the way they interact in society, the way that people perceive them. So I don't like to make judgment calls. In fact, I did a facelift on a 33-year-old yesterday. She looks fantastic. But each face deserves its own special care. So I very commonly turn people away if their expectation is not a realistic one, or if their face or the surgery or the procedure doesn't justify being done. And so that's where the judgment of the provider and the patient really have to come together to make the best decision.
In some cases, let's say a filler, how low would you go? If a teenager comes and say, I just need a filler to fix my nose. I'm just curious.
Right. I usually encourage, so anyone who's less than 18 obviously needs parental consent, and so I don't even talk to them. The one patient, I can think of an example, who came to me. She was 17 years old. She came in with her mother and wanted some filler, and I basically talked them out of it. I basically talked to her and said, listen, you're beautiful. You really don't need this. You can live, the thing that you want. One, I don't think I can achieve it with the filler. And two, it might not be the best option. Now, that being said, a really good time of doing rhinoplasty is before kids, go off to college. So that 17, 18 range. So it's very, very nuanced. There's not like a cookie cutter answer to that.
Now, one of the things I find fascinating is the psychology behind why people pursue surgery after surgery. In some extreme cases, we hear about people who've undergone over 50 procedures in the pursuit of perfection. How do you counsel patients who might be falling into this trap of overcorrecting or chasing an unrealistic goal?
I really listen. So, as doctors, the most important thing we can do is listen, because very often the patient diagnoses their own problem. And so there might be something else going on. And if that's the case, and if I can't solve it, right, maybe we need to talk to a therapist or some counseling, or maybe there's something else going on in their life where that might get them closer to their goal of happiness. I tell every patient, I want safe, beautiful, natural, and happy every single time.
So, what drew you into the field of hair restoration, and why is it such an integral part of your practice?
I think of the face as my canvas, right? And the hair in a lot of ways is the frame of the canvas. So what's a beautiful Mona Lisa without a beautiful frame? So one, I wanted to be complete in my options giving to patients, but two, in terms of hair loss, there was a gap that I saw for people of color, for curly hair. A lot of hair transplant surgeons don't want to do curly hair because it's more challenging. And so I thought that there was an opportunity to one, treat patients of color, but also increase my armamentarium that I have to offer to patients.
That's fascinating that you put the two together because I do see how it goes hand in glove, the face and the hair. Now, let's talk about something a bit more personal. You recently performed a facelift on your own mother and even shared it on social media. And I'm sure that decision came with a lot of emotions. What motivated you to operate on a family member, and what were the risks involved in taking on such a personal case?
Right. My mom motivated me. So
Go mom.
she's been asking. For me, after doing a deep dive, we did a couple of things. One, I wanted to make sure that I treated my mom the same way I would treat every single patient as much as I can, right? So the things that I did is one, I wanted to start off with doing her eyelids and her lip lift to make sure that, during surgery, on very low risk, low stakes, right? Relatively low stakes, I would be able to get through the surgery and it be, basically myself. And I was. And her outcome was amazing. So then once we felt good about that, I basically said, okay, let's go ahead and proceed with surgery. We gave her every single kind of workup that a normal patient would have. And I tell patients now, the only difference between her surgery and what I would do for another person is that she recovered in my back house. That's the only difference. And so for me, I do a lot of facelifts, and that's what I'm known for. In my mind, there are very few people who can do facelifts as naturally, as beautifully as I do, and there's no one who does as many Black women as me. And so, for me, it was an easier choice because for me to give her to someone else, I don't know who I would give her to, and that might be ego, but also I wanted to kind of give this and share this gift with my mom and restore her. And so it's been a great process. She looks younger than I do. It's been a lot of fun. People all over the world get to share along with my mom's amazing, beautiful personality.
Well, I think you did a beautiful work. She looks incredible.
Thank you.
So, mom, you look amazing.
I echo that sentiment. She looks fantastic. She is queen officially.
Yes, yes.
Thank you.
So, my next question: how do you recognize the line between a healthy enhancement and when someone might be developing an unhealthy fixation on cosmetic surgery?
I look at their anatomy and I look at their face, and I always am thinking, what can I get out of this face, and is it worth doing it, right? So I, as an expert, I've dedicated my whole life to looking at normal anatomy, normal function. If someone wants something that is not on a human's face, right, then it's not something that I will do for them. Therefore, there are certain procedures that I just don't perform. I always go back to the natural. And so if they're wanting something that is not natural, or the risk or the potential risk outweighs the potential benefit, or if I don't think that I can satisfy their expectation, I just won't do it. This is different than other types of medicine where you go to a cardiologist, they can't deny you, right? They're going to treat your heart attack. With cosmetic plastic surgery, it's a give and take. It's a relationship between the surgeon and the patient.
Yes, there's one question I ask all my guests because the tagline is where ambition meets empowerment. So the question for you is, what is the one bold step you have taken in your career or your life that truly embodies your ambition and empowered you to get where you are today?
For me, the big step was opening a practice on Rodeo Drive in Beverly Hills with no previous experience going up against, not going up against, but in one of the most competitive markets in the world, right? So at the time, I was, 32 years old, and basically putting myself out there like, hey, I'm good, but trust me, come to me and trust your face with me. And so there's a lot of risk with that, but I took that bet on myself, and now, thankfully, I'm blessed and humbled, but my practice has grown, and I've been able to help and transform, thousands of patients' lives.
Love it. Congratulations.
What What an incredible conversation. Dr. Truesdale, thank you for sharing your expertise and more importantly, giving us a glimpse into the world of facial reconstruction and beauty trends and what it really means to truly help people regain their confidence. And thank you to our listeners. And more importantly, I always say this, beauty is more than skin deep. And while aesthetic enhancements can be life-changing, it's always about finding that healthy balance. It's always about the balance. Now, for more on Dr. Truesdale's work, definitely be sure to check out his YouTube series, Beyond the Surface, Beverly Hills, and follow him on his journey to redefine beauty, one face at a time. Thank you so much, Dr. Truesdale.
Thank you, Dr.
Thank
Truesdale.
you.
Okay, you can check him out on the gram at Dr.Truesdale. And a big thank you to Dr. Daisy, our segment co-host. Thank you for tuning in to Expert on the Microphone and the Polished Beauty segment. Until next time, and stay polished. Definitely head to drdaisyayim.com or check her out on the gram at Dr. Daisy. And of course, polishedbeautypodcast.com or at Polished Beauty Podcast on the gram. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this. A Moment of Zen is brought to you by the Polished Beauty Podcast with Dr. Daisy Ayim.
I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polished Beauty Podcast or at Dr. Daisy Ayim. Remember, new episodes drop every Wednesday, so stay tuned. Please like, share, follow.